I tried doing a little bit of research on you. I didn't find a whole lot out there, but I gather that in your area, where are you right now with your practice?
I mean, we're in terms of location.
Location, yeah.
Yeah, location. So I'm in the Washington, D.C. area, but
Okay.
I practice just outside D.C. in Alexandria, Virginia.
Okay, and my aunt's out in Reston, so I know it pretty well.
Okay, yeah, a little bit further out. Yeah, yeah.
So we're going to get into talking about the very specific work that you've gotten into, but where did you start as far as medicine and treating people is concerned?
So I did my medical school training in Milwaukee, actually. So I went to medical college. I'm actually from the Midwest. I grew up in Minnesota.
I'm in Minneapolis.
You're in Minneapolis right now?
Yes, this is where
you are kidding me. Are you born and raised Minnesotan?
I am.
Oh my gosh. Okay. All right. So so I was born and raised in Minneapolis. I actually lived near Lake Nokomis.
And I live right by Lake Harriet. So
okay, so we're like neighbors.
We are neighbors.
Yeah, and then when I was in high school, my parents, we moved out to Bloomington. So I went to Thomas Jefferson.
Gotcha. Yep.
I'm a Jefferson Jaguar, and so I was out there. And then I went to Madison for my undergrad, and so I was the black sheep of the family because everybody else went to the U of M, including both my parents and my brother.
My son's just about to go, actually.
He's going to Madison or U of M?
He's going to the U of M, yeah.
Okay. Yeah. Yeah. So then I went to Madison. I was there for 5 years, and then I did medical school in Milwaukee. And so I lived there for 4.
Okay.
And actually I met my husband in Madison. He was a graduate student when I was an undergrad.
Okay.
And then we stayed together through med school, and he was a postdoctoral fellow out at NIH at the time that I was looking at residency. So then I ended up just doing my training out here.
Okay.
I did my training in Fairfax, and then I just never left. You just kind of start to put down roots.
Yeah, yeah.
And so I've worked at, actually the year after residency, I sort of, instead of just jumping back into being a cog in the wheel of treating patients and everything, I really wanted to take a step back and learn a little bit more. And so I did a kind of a self-created fellowship in health policy. I figured since I was living in the DC area, so I went and I reached out and I found a nonprofit organization that does a lot of work in women's health.
Oh, okay.
Basically translating medical information into dialogues and narratives that can be understood a little bit easier, which is kind of what doctors do anyway, right?
Right, exactly.
That's kind of our job, is to translate all that complicated information into understandable narrative. Yeah. And so it was a nonprofit that did that. And then I also did some work in a reproductive health clinic, a women's health clinic. And so I did a lot of, it was great just to, work with that population. And then I decided, I'd gotten some, just exercised some, extra interests that I have. And then I was able to bring that into my practice what I currently do. And so I've been in private practice. This is I worked at Springfield Family Medicine, then I moved to General Internal Medicine, and now I'm at Northern Virginia Family Medicine. So private practice.
Okay. And urgent care along the way too, or is mostly just private?
No urgent care. No, I'm family medicine, so trained in family medicine. So I've really, what I really enjoy about that is the relationship and the continuity of care aspect. Yeah. And so I've enjoyed that.
Yeah, me too. Me too. Yeah. I mean, I'm not a doctor. I started out working as a manual therapist, and then got into doing functional movement work with people. So teaching movement, doing postural correction work, recovery from surgeries and injuries and stuff. Also along the way was starting to practice craniosacral therapy, which is now becoming a much bigger. People are starting to understand how to use it for a lot of different things, and I'm getting a lot more collaborative work with. I do everything, with dentists and therapists, and just you name it. Actually, a lot of orthopedic issues and a lot of trauma, and so. It's been great work for me, and I was out in New York. Actually, I started a center in Brooklyn, New York, for I was there for 13 years, but I've been going back to treat people because I had, same as you, I had developed all these relationships, and I started treating newborns about 15 years
like
ago.
torticollis stuff, or
torticollis, yeah. I do a lot of feeding challenges and, you know, GI stuff, and just, you know, birth trauma in general.
It's a traumatic experience for everybody involved, including the one being born.
Right, and I think the parents often forget that, you know, that the baby just went through a tough experience too. So, but I love it's actually the one point in which I kind of start to work with an entire family, and sometimes there's like a parent, a grandparent, caregiver in the process too. So I end up with like multi-generations and families, and I love it. It's like being kind of an old family doctor. I'm doing more preventative and kind of maintenance work with people, I you know, that's part of the reason I continue to go back there, is because I have these long relationships.
That's great. What were you doing out in Brooklyn? Did you do some training out there, or?
I just moved. I just got moved to go there. I went in 2000, and I had some good friends there. Really liked the sort of neighborhoody feel. I was kind of missing that a little bit in Minneapolis at the time. And I just was totally drawn to it. I never really wanted to live in Manhattan. It was Brooklyn that I kind of got.
It was Brooklyn, yeah.
So I was
going to say, but you're like the typical Minnesotan. You left and you came back. Everybody does. I'm like, everybody's like, when is
sea turtle or something? Yes.
I don't know what it is. I don't know. Like I left when did I leave in 97? I guess is when last time I lived in Minnesota. So in a while. Yeah.
So it makes sense. I mean, I can kind of see now the transition of your work, and women's health issues are still, you know, one of those things that are not getting enough attention. So I assume that's been a big part of your career then.
It has been. I think that what I've realized is that I really enjoy working with vulnerable populations and people, populations, communities that don't necessarily, either there's a disparity in care, or they don't have a voice, either that they don't feel that they have one, or they haven't been given one, whatever that case is. And I think that's what's drawn me to that. So so the women's health, I mean, I still treat the whole family. I still treat, kids, do geriatrics, but I think that I really, really enjoy working, kind of reproductive age women, and actually adolescents. Adolescents are a lot. They're challenging, but they're a lot of fun. And I think there's so much that you can do and offer, and just that extra support, and just being a safe place for them to realize that, because a lot of times there's not a whole lot of safe places for them. So
agreed. It's something I've gotten to do a lot more of, especially this last year for some reason. A lot of kind of tween to early teen time. There's there's a lot of stuff going on with stress and anxiety, and just kind of growing into their bodies, and even sort of, identity issues around that too.
Completely. So I know, I completely agree. And just offering that safe space, and and I think also what I find, very, I guess I'm just honored that, when people feel safe and they feel that they can refer their friends or their other family members. So the community has, sort of grown also by word of mouth. And so that's important too.
Yeah. So is this kind of what led you into doing more work with the challenges that are going on with the LGBTQ population?
I think so. I think it's a sort of kind of a natural progression, just the vulnerable populations, and just finding that, when I worked, it's not like I necessarily sought it out, you just work, and then you have members of the community, you seek you for medical care. It's just, and then you develop, a relationship with them, and then you sort of realize, and they're so thankful that you're like, wow, you're the first person that's asked me that, or you're the first person that I felt that I could tell. And it's just, and so that I really was like, wow, that's really important to be that person. And, there probably should be more of us. And so so that to me, it sort of became a calling and a reason. And it's not to say I don't only work with the LGBTQ community, and I have a lot of men, cis males, in my practice too. I'd say actually the majority of them are, but it is nice also to to be able to offer a little something different to different community.
Yeah, I mean, it's interesting. It's the one thing. Same with me. I mean, and I do a lot of coordinating work with therapists, and I have a specific therapist that I do a lot of work with that community. And a lot of it just comes down to you being, and this is the way I treat in general, is that I want to understand this person's whole experience.
Mm-hmm.
If I'm going to work with them, if I'm going to work with whatever challenges they are, because my work is this very crossover between, a lot of times I'm seeing people for both chronic pain issues, but also something that's, more along the lines of anxiety and depression. And so, and that crossroads is where a lot of these, other medical conditions start to flare up, eczema and, histamine issues and food sensitivities, and all these things are at this kind of crossroads of that sympathetic fight or flight response.
Absolutely. Stress is a major contributor to, to illness and just, mental health and physical health. It's really,
So what has been your focus then? Is there anything like really specific that you like to treat, or that populations you like to work with, conditions you like to work with?
Well, I do work. I mean, I think just the path that I've led down, the populations that I enjoy working with, and that I work with a lot. I do a lot of mental health. I think that it sort of led me. It's just because the mental health care needs tend to be higher in these communities. So I have incorporated a lot of mental health work. It's been great. I'm just living in this area for so long. I've been able to connect with a lot of therapists, psychiatrists, just a lot of different resources. And we're really lucky in the DC area to have access to a lot of good resources. That being said, it's still hard to access them, right? Whether it's, and especially during this last year with COVID and, mental health. I mean, it's so hard to find a good therapist, and then also be able to afford a therapist. Yeah. Sadly, that's a limitation for a lot of people. So, and also with primary care, we're sort of the entry point for mental health too. And I've sort of, recognized that. And again, providing a safe place for people to talk about these issues. And so I do a lot of, entry level. People come to me, anxiety, depression, just pretty much anything you could think of. And I work to try to get them into a good stable, therapist, if that's what we need, or whatever, support they need.
Yeah. So in relation to the LGBTQ community, mm-hmm. what are the biggest challenges that you see in terms of access to care, or in terms of the challenges they have health-wise?
So I think one of the big issues with access is just fear to actually seek care. Okay. Fear of homophobia, not knowing that the doctor's office or the doctor or provider that they're walking into is open, is affirming. It's scary. They live that fear and that vulnerability in a lot of different areas of their life, but I think going and seeing the doctor is it's even a more heightened vulnerable experience. Yeah. And so it's scary. So I think that just seeking the care, I think is an issue. And then I think, this community, unfortunately, does have and I think I've alluded to this already, do have a lot of mental health issues. Yeah. It's complex. And so that's something that I find that I'm treating quite a bit.
And how do you address something like that when you sense that someone coming in, or are they able to express that to you, or is it something that you have to kind of help them understand?
Yeah, that's a great question. I mean, so and so a lot of times, I mean, I think it is just asking the right questions, right? I mean, yeah. I think that's something that primary care doctors either don't have time to do, or maybe they don't want to incorporate that. They're afraid of some of the answers, or even if they do ask those questions, what are you going to do about it? Where do you have the resources to even, to offer the care that they need? So, I do, safety assessments. That's something that's really important. So, and it's not, it's pretty much for anybody who comes into the office.
Yeah.
You feel safe at home, just trying to screen for, something that might be amiss. And also it also gives them the invitation that this is this is somebody that I can talk to. This is a safe place. I can talk about these things. I think it's also important to, especially with working with adolescents or anybody, is to confidentiality is also something to be very upfront about, and mentioning that this is a conversation between you and I. So, and a lot of times just making sure that once you introduce that, or know that that's the, that's the format of which we're working, a lot of times people do relax a little bit in, because they just, are you going to tell my mom, or, or are you going to call my partner, or whatever the situation is.
Yeah.
And, and it's so that's helpful in bringing out conversations.
Yeah.
But I think a lot of it is just asking the right questions. And we do have regular screening that we use, the PHQ-9 for, this is at every, not at every visit, but at the, at physicals, or if I get a sense that something's, not right, then we'll just do an assessment.
Yeah.
And so that's helpful. And sometimes people come in and they don't necessarily even recognize that what they're experiencing is anxiety or depression. I mean, you probably run into that a lot too. The infamous, the somatic complaints. When the body is screaming, there's something wrong, but when you're not listening to your brain, so then the body starts to get, pain involved, or whatever it is.
I see so much of it. Yeah.
Mm-hmm.
And I mean, the nice thing with I usually have somebody who's pre-screened, so in a way it's either another doctor that I'm working with, or a therapist that I'm working with, who identifies a lot of the physical stuff going on. And they've already probably identified some other stuff going on, or they wouldn't be working with this other, doctor or therapist. So it's a little easier for me, but even so, I think sometimes it needs to be reiterated, because I think people don't realize how much that emotional experience gets stuck in the body, and just in the way that it works in the first place.
Yeah,
and responds. So if it's become a system, and this is like a very important thing for people to understand, is that if the body the nervous system loves to work in these patterns, and so it becomes sort of programmed as a response in the system. And then, that is part of what this pain response is. So it's grown over time in response, right? And that it kind of has to leave in the same kind of way. It's not anything that's going to be a quick fix. And for that reason, I'm sure that's, when it gets very extreme is when we need to use a medication, or we need psychiatric sort of, some input that way. But there still needs to be these other parts to kind of help balance that. So you have kind of a team of people that you've been working with these kinds of things?
I do. I mean,
refers.
Yes. Yeah. It depends on what it is. It's, I think, just speaking of somatic complaints, or, physical complaints that go along with anxiety, for instance, irritable bowel syndrome. I don't know if that's anything that you've worked with, but they say, it's, we're finding now that the gut is, considered our second brain.
Yeah. I just did a podcast on it, so it'll be.
Oh, did you really? Yeah, no, I mean, it really is. Yeah, no. And it's just, the amount of serotonin, the serotonin receptors in the gut are, there's probably more serotonin receptors in the gut than there are in the brain. So, so that's something. And so there's a therapist that I work with that actually uses hypnosis to help manage IBS, which has been, fantastic. I think that it's, and everybody, you really have to figure out what headspace the patient or the client is in also, and what they're going to be open to.
Yeah.
And sometimes you have to work towards getting to this. It's not, usually hypnosis for IBS is not the first thing that I'll that I'll mention, but it is, but, some people are more open to it than others. And honestly, there's been, we've got some pretty good results from using it.
Yeah. And so I know that there's also a challenge for people who are taking gender affirming hormones as well. So can you talk about that? There are some health related things that maybe they're not aware of, or even a lot of the medical community may not know about.
Yeah. So especially for trans women who are taking gender affirming estrogen in order to develop a more feminine appearance, that the estrogen can actually increase risk for breast cancer is probably one of the biggest things that most so men, cis male, that they don't, there is still risk for breast cancer in men. However,
right.
It's not quite as much as women, and a lot of it is driven by the estrogen.
Okay.
So that's something to also pay attention to. So it's just understanding the screening tests and knowing what tests to order. I think it's important in part of the interviewing process that I do with patients, and also it helps create an affirming safe space, is to ask questions that what was the sex that you were assigned at birth. Okay. And currently, what is your gender? What is so it just sort of understanding, because if you were born assigned female at birth, you will have female anatomy that we do still have to be aware of. And so there are trans men that I have to screen for cervical cancer. So but it's just being aware of that, and so understanding it gets a little bit complicated, and that's why being open and having these discussions is important. Yeah. And the LGBTQ community, especially women, lesbian women, tend not to come in for a lot of their healthcare screening, and so that what I mentioned, the cervical cancer screening tends not to get done. The breast cancer screening tends not to get done. And so we actually do see some higher rates of cancer in women. And it's not because we don't think it's because of their sexual orientation. It's more of the fact that they're just not getting the healthcare and the screening that they should in a timely manner.
And do you think that's because of how they think they'll be perceived in getting care?
Potentially. Again, I think it's complicated to know, but again, like I had, as I had mentioned before, just even the access and feeling safe is something. And also, I think there's also a misconception that that because you're a gay woman, that you're not going to get cervical cancer, you're not going to get HPV, but that it can still happen. And so some of it just might be disregarding that this is an important test, but the guidelines are, no matter what your sexual orientation is, who your partners are, we still do want to screen for HPV. There's no change in the recommendations if you're gay or if you're straight. Yeah.
And I've been wondering about this too, because I see it a little bit in my practice now that I've been working with some of these kind of tween to young teenagers, is this, that, and I'm sure this happens at older ages as well, when people are kind of starting to question, what their orientation is or how they identify, and they're going to try on some different things for themselves to kind of figure that out. And so, some parents are really good about this. If it's a boy who wants to wear fingernail polish, or a girl who wants to cut all her hair off or something. But is there anything that you can tell us about your experience with that, and the way that you kind of talk to parents about this situation, or even just talking to adolescents about it?
Yeah, I think just again, it's a complicated situation, because there can be a lot of family dynamics at play.
For
And
sure.
so yeah, but I think that we also know that that parents that do support their children and adolescents and teenagers, especially if they're questioning, the more support you get from family, the less depression, the suicide rate is much lower. There's a lot of just amazing benefits. So something that I really try to strive for is to try to encourage parents, if they're open enough to it, just to trust in the process and really just try to support their child through this. It's there can be difficult conversations. It's not that this is going to be easy, but I have to say that more and more parents I'm finding are, at least maybe it's in the population that I'm working with, there's a lot of acceptance and a lot of openness and a lot of wanting to support their children, which is fantastic. But I also see a lot more children and adolescents questioning and coming out and just, maybe trying on a different gender, or, it's just, and I think it's a time for exploration. I think it's such a normal.
That's the way I address it too. This, there will be a process here, no matter what, they decide to do with their lives.
Absolutely.
This is just one piece of that. And so, and I have a 10-year-old daughter who's, I've just been having some conversations with about it, who's asking me questions about it. And so, and I think partly because, you have a month devoted to it and people are starting to talk about it a little bit more. And so she has a lot of questions, and, I just try to be present and, talk about my experiences, and, also that I think we all kind of exist on a certain spectrum that culturally we're not as comfortable accepting, but to me, that's, especially living in big cities where people who have, come from rural areas who have struggled with these challenges, I've gotten to meet and work with a lot of these people. So
again, it's very different. Like I was saying, I work outside of DC. And so a lot of a lot of people I'm working with are probably, a little bit more used to these ideas. They've been exposed to that. It's something that, but it can be very different depending on the community that you're coming from. And that's, that can be a very, very challenging situation.
Yeah. Do you have any suggestions for anyone who is LGBTQ and may, be feeling like they haven't been getting care? They, depends on what their age is, that they may feel like they have some health challenges, or they didn't do certain screenings that they should, where to kind of, first steps for them?
I think, first is, looking, do they have a primary care doctor? Do they have somebody that they usually go to? And if they feel comfortable and safe going and, maybe asking, just scheduling that physical that they haven't had in 6 years or whatever it is, just taking the first step and just saying, I didn't realize that there could be screening tests. There's things that I might be missing. So just recognizing that. But then, the issue is that either you don't have a primary doctor, or the one that you're seeing, you don't necessarily feel comfortable. So it's a process, because I think it is so important to work with somebody that you feel safe with, that you feel that you can talk to. And whether it is talking to other friends in the community about doctors or providers that they see that they like, that are open. I think that's important. And then, a lot of other, practices are starting to, place the rainbow flag on their website, or, even in their waiting room, and just, just being able to find, a practice if that, that has that, if that's important to you. And if that's going to help you get the care that you need to have that safe environment, then I think, you can find it.
Do you know if there are any national kind of organizations or places that have a health, kind of resource list or anything like that?
I'm not sure if there is. I know that PFLAG, I love that organization. A lot of times there is sort of a regional
Okay. Yeah.
And they'll sometimes list, doctors that, that are, affirming, sometimes also, doctors that do, hormone, affirming therapies. And, so there are a lot of resources through PFLAG.
Yeah.
And I mean, sadly, a lot of this is, almost like a word of mouth, like kind of like the underground, like where can you find the support that you need? But, we're working to try to make it more mainstream and something that's more included, and I have to say, I went to medical school I started in 98. So 98 to 2002. I don't think I had any instruction about taking care of the LGBTQ community, not a single lecture or anything. Yeah. And so I think that it also has to start at the earliest level of training and making sure that vulnerable communities and the LGBTQ community are incorporated. That's, in early education.
Yeah. And I feel like even for parents who have a child who's sort of questioning or, starting to explore, I think that's a great point, to just have a therapist, to try to find someone in mental health that they can just, bounce things off of. Because in a way, this is the way I think about it as a parent, is like, I want to be the parent. I don't want to be trying to like manage my children's mental health. Even though I know a lot, I feel like I want that to be a separate relationship and a confidential relationship in many ways. And because as my kids get older, I'm going to be developing a different kind of relationship with them as adult children too. And I want to make sure that becomes something that wasn't a conflict in those years.
Exactly. Yeah. No, it's always hard. I, being a family medicine doctor, I have kids too. I have two sons, 12 and 14, and I've made a point not to be their doctor because I feel like I'm their mother first. Right. And you've got that emotional, my reaction to anything that's going on with them first is emotional. It's not necessarily the clinical, which is the way I approach, other patients that are a little bit, that are not my children.
Yeah. Yeah.
So it's important just to find that support community, and don't, and it doesn't have to all be on your shoulders. I mean, you're an important part of that support community, but you don't have to do it all.
Yeah. One thing I found here, I do some specific work with a sex therapist who does a lot of work with this community. And I think part of the reason is because they've probably identified the fact that if this person's comfortable talking about anything about sex, they're probably comfortable talking about anything that may be coming up in terms of sexual health or even relationship challenges.
Yeah.
So that can be one of those. I mean, I'm just trying to kind of think about any ways to help lead people to some resource when they're struggling with this stuff too.
Yeah. It's I mean, hopefully you're going to have a doctor that, that will ask, the right questions as well, and do the right screening tests. I mean, getting a physical is really important. And, a lot of times, you don't think a whole lot is done at a physical, but honestly, there is so much screening, or it should be a whole lot of screening that happens. I mean, not only, we talked about the mental health part, but also substance abuse. And I don't think we've touched on this a whole lot either, but the substance abuse is also something that we see a lot more of in the LGBTQ community. And so you're doing screening for that. But usually there's so many layers with the substance abuse. A lot of times can be a kind of a coping mechanism, or, a self-treatment for underlying anxiety and depression. And it just, so there's a lot. Yeah. And the other thing I'd say is, just be honest. Be honest. I mean, you're not gonna, it's hard, if you aren't going to be honest with your doctor about, how much you're drinking, or, I mean, but you also have to ask the right questions. I can ask a patient how much they're drinking, but then a follow-up question will be like, well, have you ever thought that might be too much? Or have you ever thought that, have your friends thought that, that there might be a problem? So asking things in that way sometimes helps you think about it in a little bit different way.
Yeah. And as patients, one of the things I always suggest to people who are seeking a new kind of provider. So this is kind of across the board is, if you're trying to find someone who you feel that you want to make sure that they're comfortable with LGBTQ issues, you interview your medical people.
Yep.
Ask them the direct question that you want to know about, both in terms of what is their expertise in treating, what you have, or working with your population, whatever that might be.
Yep, absolutely. I mean, you just, you have to become an advocate for yourself somewhat when you're, trying to find a doctor, try and find anybody, working with anything. Yeah. So I completely agree with that.
Yeah, I feel like it's the one thing that I do. That's part of the reason I'm so picky about who is my whatever it is, if it's an acupuncturist or whatever. I usually come out of the gate with a couple of really strong things, because how they respond to those things right away tells me if they can handle a challenge or that kind of stuff. And if they pass that right away, I'm usually sold. So. Yeah,
no, you have to be aligned. I mean, this is somebody that you're working with, not working against.
Right. I'm trying to build a team usually,
It's exactly. It's really important to have that have open communication. I think being able to feel that you can communicate, but again, that you're also aligned on the direction that you're going.
Yeah. Are you doing any kind of speaking? Are you doing any kind of videos? Do you do any social media stuff for your work?
Well, so we've started a podcast. Actually, a colleague and I have started one. We haven't dropped any episodes yet, but we have probably about 8 or 9 of them recorded, and they're being edited.
Oh, great.
Yeah. So that's really, really fun. It's called Living, Breathing Medicine. And It's basically what we're doing is just we're talking with other healthcare providers, other doctors. It's a lot of storytelling on, looking at the human side of medicine and the experience that we've had with patients and how we can make. Pardon me?
Like cases that you've worked with, or
it can be cases. We'll start with that, but usually it turns into just what is good medicine and how we can achieve that, and also exploring compassion in medicine a little bit more. So that's we're just trying to get down kind of underneath it all. It's but a lot of it's through storytelling, which is really, really fun. I mean, doctors are actually really good storytellers, and if you get a couple of doctors or healthcare providers in a room together, I mean, there could be some pretty amazing stories, and but we're trying to explore more compassion in medicine. Yeah. So that's something we're doing. I've been doing a little bit more writing a couple of different blogs. We've been, I think I'm interviewed for a couple of different articles. So just, kind of working at getting information out there. I think it's great to be able to reach beyond the exam room for me. Just reaching beyond the patients that I see in the exam room. I like to.
Yeah, me too. I mean, that's part of the reason I started this in the first place. Yeah. I've been very fortunate to have the practice that I have. And I know there are a lot of people who don't have access to, care providers like us. So.
Yeah, I know exactly. And so if you can, connect somehow, I think that's so great, because there's a lot of, great information that I think we can share, and also just work to empower people to really, be kind to themselves and you find the people and work with people that they deserve. Yeah,
I love it. Well, I'm thankful to be connected to you, and I'll put up links for all the things that you have going on right now too. So
sure, yeah, I can send stuff to you as well if you want.
Okay, that's fantastic, and part of what I'm doing with this project is also starting to kind of work on having a guest page for all the people who are on the podcast, so that if people are starting to look for resources, they're starting to look for resources in parts of the country that they can find them. So you will be on there, and one of my good referrals for out there too. So that's great to have.
Yeah, absolutely. Happy to chat more about anything.
All right, sounds good. Okay. Thanks so much for doing this with me.
All right, no problem. Thanks. Great to meet you, Jeremy.